Good afternoon. Thank you for calling Interim HealthCare. How may I direct your call? Thank you. One moment, please.
You ready? Okay.
You ready? Very nice.
Straighten and step. Straighten and step.
I had one of those days that is the day that turns your life around. I was practicing divorce law, did not like what I was doing, and one afternoon, after just one of those days, I said, I need to do something different. I need to give back. I need to make a difference in my community. What we do for a living makes a profound difference in the lives of people, and we don't take it easy. I think what you need to do is be sure you meet the commitment standards that Interim nationally has set.
That's why I became a therapist. You know, you have the age old, when you ask people why do they become a therapist or a nurse or anyone in the healthcare field, usually the answer is I want to help people. But that truly is what I wanted to be able to do. So when we walk out of, particularly in home health, we don't have a lot of the equipment that you have in the outpatient centers, but you're still able to achieve the goals the patient wants in their own surrounding. It just epitomizes everything that you wanted to do when you were that new grad out to save the world.
You are going to become a very serious member and part of the community in which you'll serve. First thing you need to do is look into the markets and see where's a market that looks like it has growth potential, where's a market that possibly doesn't have either an Interim office or a number of other home care agencies. And then get more serious from that point. This is the type of business that you find yourself personally growing from. That's exactly what we did. We have 7 offices now, and my first office, when I opened it with 1.5 people. That's 1.5 FTEs, not one person that was only half. I, of course, did almost everything. I handled the HR, I handled the payroll, I handled all of, and that in itself was enjoyable because you found yourself delving in all areas of business, learning so much, and growing each and every day. And then you make the decisions on the next stage. Do we need more help in the office? Do we need more help in the clinical side?
Here it really is a family business. I mean, my father started it, my stepmother's involved, I'm here. But it's really neat to be involved in something that you can wholeheartedly say has been a part of your life from day one. That you watched it grow and you watched the struggles and you watched the triumphs and that you've been part of it. And now to be part of it to where every morning I come in and sit down in my office and get to help build the business and take it to the next 30, 31, 32 years. I think that's probably the most incredible thing that I could ask for.
I was the president of our Home Health Association for the state, and I can remember folks coming to me that were in healthcare asking for help. They were competitors, and they were coming to me because they said, we have never been trained in this. We don't have support in this. And I see that all the time, and this is even large national companies. They don't meet the training, support, and have the right mission as Interim does.
Interim corporately is such a cutting-edge company that they will really, adhere to and feed your desire to do something different, to branch out, to expand, to offer more services, to touch more people. And that's what we do. We care for people.
I am so glad I did it, and I'm glad, and even after 31 years, I'm saying I am looking for another 31 years, if it's all possible.